Across countries in the World Health Organization's Eastern Mediterranean region, we've achieved great progress in managing diseases. Unfortunately, we've achieved very little progress in managing the suffering of people living with diseases. The solution lies in palliative care, but regrettably, this remains woefully underdeveloped across the region. Palliative care aims to improve the quality of life of patients facing problems associated with serious illness. Indeed, a 2014 World Health Assembly resolution calls upon WHO member states to integrate palliative care as a core component of health systems and make it accessible to anyone who needs it. In fact, it is now explicitly recognized as a human right to health. There are, though, many misconceptions regarding palliative care. All too often, it is associated solely with cancer and end-of-life care. However, palliative care is required for a wide range of chronic diseases in both adults and children. And crucially, it is not expensive. In fact, research has consistently shown that it is a proven cost-saving public health intervention. This is because, when considered early in the course of an illness, it can reduce hospitalizations and the unnecessary use of healthcare services. In the Eastern Mediterranean region, it's estimated that approximately 2.1 million adults and nearly 500,000 children are in need of palliative care, but that fewer than 1% of these patients receive it. That's a lot of deserving people slipping through the net. Elders with dementia or AIDS, parents with respiratory disease or heart disease, children with cancer or neurodegenerative diseases. And there are multiple issues causing their serious health-related suffering, including physical suffering, such as pain, vomiting, and difficulty eating, drinking, or breathing. Psychological suffering from anxiety, depression, or guilt. Social suffering from the inability to maintain a professional role or role as a parent. Spiritual and existential suffering when people ask, "Why me? I'm a good person." Practical issues including the inability to feed or dress oneself and difficulty getting to a doctor. Concerns about finances or for family left behind. And grieving for a lost future, such as becoming a grandparent or seeing your children graduate from college. In 2019, the WHO Regional Office for the Eastern Mediterranean, in collaboration with others, established an expert network whose team of regional and international specialists developed a roadmap for palliative care. The roadmap includes strategic objectives in policy, human resources, service delivery, and other relevant areas. Ultimately, palliative care is not about how long we live, it is about how well we live. Going forward, we must work together to ensure it is accessible to all who need it.